done away with pre-existing conditions. So pre-existing conditions are no longer a barrier to getting health insurance coverage. If one has a pre-existing condition, that will not be held against you in any manner in order to obtain qualified health insurance coverage within the exchange and outside of the exchange as well, since the ACA applies to plans inside and outside of the exchange. Yes?
And will the situation remain the same? If I have a pre-existing situation, will that also be factored into how much I would have to pay for coverage?
It depends. It depends on the plan that's selected. Absolutely. Because each plan is set up differently, but it won't be a barrier to getting coverage.
I have a question.
Yes.
Would they ask you that when you're online enrolling?
There's some health-related questions that are going to be asked, but not a detailed medical history.
And when you apply, are you automatically then covered, or is there a waiting period?
There is a waiting period, and it really depends on when you apply. So October through December, if you apply, then your coverage begins in January. While we're beginning enrollments in October, coverage really doesn't begin for any of the plans until January 2014. The timing issue is dependent on, really reflects if you apply at the end of the month. So your application process, the enrollment process, isn't complete until the first month's premium is received by the carrier. So let's go back a couple of slides. So if one applies for Care First, and you apply online, and you hit select, that first month's premium, part of the application process is paying for your first month's premium online or submitting a check or money order to a designated address in order to have that first month's premium count. When it hits the carrier's website is when the application process is complete. If you apply in the earlier part of the month, between like the 1st